Welcome back, everybody. I'm the Dr. Bob Lee from 107.5 WBLS, and you're watching Open. Thank you so much for being with us. Our next guest is he's the CEO of the Harlem Hospital Center, and he's here with us today to speak about his role with the hospital and how it has ensured that patients' needs are met. So please welcome to the show, George Leconte. George, welcome. I know you've worked in the business for some time now, and you were at Elmhurst Hospital, and now you're at Harlem Hospital. Give us a little view of your travels, so to speak.
Sure, Dr. Bob Lee. Started off my career at Elmhurst Hospital many years ago. Grew there, and recently was appointed CEO of Harlem Hospital, and I'm so pleased to be here. Such a great institution. Thank you.
Congratulations.
Truly appreciate that. Harlem Hospital is a cornerstone in the Harlem community. I can tell you that the folks here are just magnificent. Since I've started here, the one thing I've told everyone is that I've received what we call the Harlem hospitality.
Yeah.
The folks here are so grateful, so wonderful. The only thing I say is that they don't have that Southern accent, otherwise, really wonderful. What we're doing is ensuring that we provide the best care possible for the community here. There are a lot of the folks that are here. This is their hospital. This is their community. This is where they want to come to get their services. And we work very hard to make sure that we provide all the services they need right here at Harlem Hospital. We have a number of different environment and areas that we're trying to grow through our OB service. We're making some leaps and bounds in that in terms of growing our OB service so we can provide proper maternal care for our pregnant women, and also our pediatric service, which is excellent service. We have some really wonderful doctors here to take care of some of our folks. Our surgical services, we're trying to grow it. We're looking at adding a robotic system into our surgical service to be able to do robotic surgeries. It's a hospital that's really growing leaps and bounds, truly.
That's state of the art right there. Yeah.
Oh, yeah. Oh, that's one of the things that we definitely want to do, is make sure that our patients here at Harlem receive state of the art care. And we truly want to continue to do that.
What is your primary role right now with the New York City Health and Hospital Center of Harlem? I know you're the CEO, but what do you want the public to know about what's happening at the hospital at this point?
Well, I think the key thing I want the public to know is that this is a great hospital. We provide key care to everyone, and I mean everyone. I don't care who you are, from billionaire to the unemployed, undocumented individual, and we provide that care without exception. It's not who you are. It is, once you walk through our door, you are one of our patients, and we take excellent care of you. We recently received the LGBTQ award just last month. And we also were known as the 7th most diverse hospital throughout the country. We're number 7 in the whole country. So, this is a hospital I'm very proud of. I'm very proud of the things we do here. I'm very proud of the staff that work in here. I will tell you, they are hardworking individuals. They are committed individuals. They are individuals that really care about the community. They really care about our patients here. So I'm blessed. I'm blessed to be in this position, quite honestly.
Yeah. I recently, well, not recently, but I spoke to one of your retired nurses there. And Harlem Hospital has a lot of history. Of course, it's not too far from where Percy Sutton and the whole crew lived. And when we did Harlem Week, we have a stage out there. And this woman came up to me and says, I'm the one that took care of Martin Luther King when he came to our hospital.
Yeah.
I forgot the woman's name, but every time I see her, she'll remind me of that. I think she's retired. Of course, she's retired from it now. But she's still, that's like one of her things that she's very, very proud of. She took care of.
We have a nice documentary, How Harlem Saved the King.
Yeah, there you go.
Really a great documentary that really sort of details how, really Harlem Hospital saved Martin Luther King. And so it's a fantastic concept.
Excellent, excellent. Anything coming up in the community that we should know about or in and around the hospital?
Well, the key thing right now is, that as we're getting off the pandemic path, which hopefully will stay within that pathways. We've been trying to get our hospital back in order and have everything back in norm form as best as you can call norm, in today's environment. We're hoping to get the hospital back into an open aspect where, we have this beautiful pavilion that we'd like to share with the community.
Yes, yes.
We've not been able to do that. The pavilion's just amazing, and we have some artwork in there that is just amazing. And what I'm hoping is that as we die down with the Omicron wave, we could actually open the hospital up to a certain limit and have some folks come in and visit our hospital and see the beautiful structure that we have here, see the care that we provide, and also see some of the wonderful artwork that we have here. And we've been working with some of our community folks that has provided some artwork in here to try and open it up and give it, make it possible for the community to be able to share this with.
You also have a wonderful auditorium. Is it on the 5th or 6th floor or something like that?
It's on the second floor.
Second floor, yeah.
Yeah, it's really a beautiful auditorium. Hopefully one day we'll be able to open it back up again. And again, with the COVID outbreak, that's sort of put a hold on it for us. But we're hoping that soon we'll be able to open it up and get some more activities going into the institute.
George, you see that it's opening up a little bit more? You got less patients coming in with COVID. How's it look?
Oh, there's no doubt about it. Well, a number of patients are, and again, the COVID situation is not over yet. Let's not fool ourselves. I do encourage people to please get booster shots. The CDC just recommended a second booster for folks 50 over, and also people that are immune compromised. The new wave, the B2 wave that's going through, is certainly a lot more communicable, not as dangerous, not as deadly, but it is certainly a lot more communicable. So one of the things I do say to that is make sure you continue to get your booster shot. I know there's been debates on mask or no mask. We at the hospital, we still say mask, okay?
Mask.
Because we don't know who comes into the hospital. What we have been seeing also is a number of flu cases that we've seen also coming up. So not just COVID, but flu also has been prominent here at the hospital.
So again, mask, it gets rid of
flu. Thank you. It gives you a combination protection for both flu and also the COVID concept. But I do say that we've been seeing less and less of COVID positive patients. Currently today, there's only one COVID positive patient we have in the hospital as of this morning at 9 o'clock. We've been running single digits for quite some time now, at least for the past month or two. We hope to keep it that way.
And well, we keep telling them the 3 Ws: wear that mask, watch your distance, and wash your hands.
Yes.
Act like a doctor. Wash those hands.
As things open up, one of the things I want to do, I want to invite you to the hospital. Okay. I want to
love that.
And take a look and show you all the wonderful people that work here and all the great things that they do here.
You got it. And congratulations once again, your new position as CEO. George, we love you. We love all the work that you've been doing over the years, and we appreciate everything that you're doing in our community and at the hospital.
Well, I can't thank you enough. And thank you for all the great work that you do, always. We've known each other for a number of years, and I have nothing but the highest regards for you. So thank you. Dr. Bob Lee, I thank you, sir.
Thank you, George. Hey, George, give us the website. Where can people get more information on the Harlem Hospital?
Where people can get more information is at this website, New York City Health and Hospitals /Harlem.
There you go. George Leconte, CEO, New York City Health and Hospitals, Harlem Hospital. Thank you so much, George.
Thank you, Dr. Bob Lee. Have a great one.
You too. All right, we'll take a break right here. We'll take a good break right here. Coming up next, I've got a whole lot more.